My dear friends, in next 10 minutes or so, I'll try to explain to you why we need an antibiotic surveillance program. The reason for and need for or the most important need for antibiotic surveillance program is that antibiotic resistance has already developed. So we should do something to prevent spreading of this antibiotic resistance. Can you identify this person? He is Mr. Albert Alexander, who was a constable. In 1942, he had rose-thorn injury and he developed sepsis secondary to that injury. And in 1929, Sir Alexander Fleming, he discovered penicillin, the first antibiotic. Though it was discovered in 1929, it was not being used for treatment of patients till 1942, when two doctors, namely Flory and Chain, used this antibiotic penicillin for this person named Albert Alexander, whom I have mentioned, that police constable. He survived for 5 days, but unfortunately he died on the 5th day. With the use of penicillin, it was the beginning of antibiotic era. Till the beginning of this antibiotic era, penicillin used to be, and with the advent of penicillin, it was well known to everybody to be a wonder drug which saved the lives of so many people in World War. Prior to this antibiotic era, pneumonia meant death. Severe foot infections meant death. That time, the treatment for foot infections or leg infection, especially during war and all, the treatment was amputation. But the antibiotics changed everything. When I was doing house surgery in 1993, death due to infection was so rare. I still remember when one of our patients died of pneumonia. All our teachers from the Department of Medicine, they were feeling so sad that somebody has died of infection, even with the availability of antibiotics. So these antibiotics we believed them to be wonder drugs to protect us from evil bugs or evil. But now is the time of the triumph of the evil. Now we see patients dying of pneumonia. We see patients dying of foot infections. So all these things are due to development of antibiotic resistance. These microbes are resistant even to high-end antibiotics. The saddest thing is no new antibiotics were discovered beyond 1980s. Old antibiotics have started making a comeback because no new antibiotics are discovered, but unfortunately these bugs are becoming resistant even to these antibiotics like colistin, which have made a comeback. The situation is not different in our place also. You can see there are infections, my Proteus serratia, Elisabethella, Kingella, etc., even resistant even to colistin. Then E. coli, Klebsiella, Acinetobacter and all have become resistant even to Piperacillin tazobactam. And if you see this report of Klebsiella pneumonia, only 4 drugs are sensitive, of which actually even colistin is having only intermediate sensitivity to this Klebsiella pneumonia. So it is predicted that by 2050, this antimicrobial resistant drugs infections will cause more death than due to even cancers and diabetes. This problem of antibiotic resistance was predicted by Sir Alexander Fleming in his Nobel Prize lecture in 1945 itself. His prediction came true in the same year itself. They started using penicillin in 1943, and resistance was reported in as early as 1945. The same year, Sir Alexander Fleming received Nobel Prize. Then so many other antibiotics have been discovered, and you can see some of these drugs, especially these quinolones, they developed resistance in the same year itself. Even daptomycin, the only drug which was discovered beyond 1980s, and that drug developed resistance within 1 year. So this era of post-antibiotic era, because when bugs become resistant to all antibiotics, it will be as good as no antibiotics, because it will be same as pre-antibiotic era, even before the discovery of penicillin. So patients will die of pneumonia, patients will die of all other types of infection. So WHO has started its fight against antimicrobial resistance, and they have advised all of us to start fight against antimicrobial resistance. It is already late, and we should wake up to reality. How do we help in development of resistance? We help in development of resistance by few things. One is use of inappropriate antibiotics. Then when we use unnecessary antibiotics, when we use inadequate dosage of antibiotics, and when antibiotics are given for inadequate duration, when we give poor quality antibiotics, or when there is lack of infection control in our hospitals, all these things help in development of antibiotic resistance. So the present era is even called to be post-antibiotic era. So remember, we can die even with rose thorn injury. Pneumonia means death now. So this is the picture of Mr. Albert Alexander. So he died in 1942 because of rose thorn injury, and same thing can happen nowadays also because of this, with the advent of this post-antibiotic era. So it is not only for what we do that we are held responsible, but we are also responsible for what we do not do. So we should do something. Where can we intervene? We can intervene in some areas to prevent development of antibiotic resistance. We can reduce the ease of availability of antibiotics. We can develop a surveillance of resistance of various antibiotics. We should avoid clinical misuse of antibiotics. We can avoid using poor quality antibiotics. So where can we intervene? We can develop hospital-based antibiotic surveillance program. We should act before it is too late. Or is it too late already? Let us do something immediately before it is too late. And let us hope good will triumph over the evil. Thank you all for your valuable time. Thank you.